Hi, I'm Angela Berg. I'm a doctoral nurse practitioner here at Care for the Kids, working in pediatric rheumatology and complex care. I've been part of the Care for the Kids family as a founding board member since 2007 when we started, and have transitioned into a provider role from various nursing roles. So I've been chief toilet plunger, bottle washer, whatever we've needed as we've grown and become what we are now. So I'm very vested in the mission here of making a difference in the lives of kids and their families in Southern Nevada. And it's important to me that more specialties become available. We don't have the infrastructure here, and we don't have a freestanding children's hospital yet. So it's very important what we do to make sure that we're allowing families to get specialized care for their children without having to travel from 4 to 8 hours away to be able to get that from an academic medical center. While we don't have an academic medical center here, it's important what we do because we are so active in educating medical professionals, nursing students, pharmacy students, nurse practitioner students, physician students, all come here, and we're active in participating in their education and supporting our ability to grow specialized care for pediatric patients in Southern Nevada. So I went back for my doctoral degree to specialize in pediatrics as a nurse practitioner, and at that time there were no programs open in Nevada. So I went to University of Utah, which was a good fit for me for being a highly successful educational institution. So I was able to do the majority of my clinical hours here in Nevada and make those arrangements, and then just drive back and forth and join online to be able to complete that program. So I completed that program in 2015 and have since then transitioned into being a doctoral nurse practitioner. And as such, when I was doing that program, the reason I fell in love with rheumatology was doing some of the residency hours for my doctoral degree with Dr. Marzan when we were partnered with CHLA, and found out that rheumatology had a place in my heart along with complex care. So while I was doing the residency hours with Dr. Marzan, I discovered more and more of my own family history in autoimmunity and how autoimmunity has affected my family, and the importance of people not being dismissed, or that this is often a specialty where people don't get the care and just think that they have to live with it. And so it was really important realization for me that it impacts quality of life so much for those we serve here in Nevada, and it is such a huge need. It includes a lot of conditions that lead to chronic pain disorders in kids, and these are chronic lifelong diseases that you can live well with instead of having them control you. And so it was important for me to support that incredible need. That's the whole reason that Care for the Kids exists, is the need in the community was identified, and that dream, vision, mission grew from knowing that we had such a need. So it just became an important part of my heart because of identifying then how additionally I could also support my own family and all of those we serve, which are like family to us too. So when COVID happened, so many things in our world changed, and our visiting provider program had to take a hiatus because providers weren't able to travel from their outside institutions to come and provide specialty care here anymore. And so Care for the Kids really continued to take the lead in recruiting and found collaborative partnerships in the community. And we were so blessed to be able to have met Dr. Joshi actually the first time before COVID happened, when he was still finishing his specialized training. And then we were fortunate enough to have him come join us now at this point. So it's very exciting that we've expanded that accessibility to this specialized care for kids in rheumatology with his profound expertise in chronic pain issues and being an expert in musculoskeletal ultrasound, which helps us be able to minimize kids having to go through sedation and things for MRI. We're able to more efficiently manage doing an ultrasound on a joint and making an immediate diagnosis, yes, arthritis, not arthritis, for example. And so we're really, really fortunate to have him here and really be expanding that care. And we're really looking to grow the program with another doc already joining us next year. So I feel like my role has been able to know that history and have some management in my background and really help support him in developing this into a robust rheumatology program that's going to be very sustainable and be here for the long haul. Dr. Joshi and I are a great pairing. We see most patients together so that we both are managing the entire cohort of rheumatology patients, so that we both know the patients well. I'm able to do that nurse practitioner looking from the 30,000-foot elevation and complement having a physician too. So the model of care that we're developing with having the physician and nurse practitioner together are a distinct advantage. You get that very cellular level scientific background of the physician and all of that expertise that Dr. Joshi brings. So I continue to do a lot of the care coordination, coordinating with other specialists in the office, in their offices that need to be a part of the care, and making sure that all of the full circle of care that these patients usually need when they're complicated or have a systemic illness pulls it all together, and I'm able to do a lot of that coordination role in support of the work that Dr. Joshi's doing in his role as the primary physician of the program. We're different than a traditional primary care model because of the nonprofit status. We have the additional availability to seek grant funding to help support infrastructure that can provide a more comprehensive model to care for these chronic kids. Oftentimes a pediatrician, and particularly even crossing over with my work with complex care, it's a specialty in and of itself to know that there are so many moving parts that need coordinated and collaborated. Rheumatology is really an art of putting together a puzzle. Usually patients come to rheumatology after they have been to multiple specialties and had many things evaluated already and don't have answers. And rheumatology is often the puzzle piece collector to put the full picture together to help get to the bottom line. There are times that things aren't autoimmunity, but they're autoinflammatory, and we're still able to help identify and provide an answer for that. Things like chronic pain oftentimes come from painful stimuli that come in, and those chronic pain syndromes like CRPS and fibromyalgia fall into that rheumatology specialty too. Dr. Joshi always likes to talk about the 3 buckets of musculoskeletal pain. You first have to make sure that there is not an autoinflammatory process happening. Make sure that you're not missing something that's actually treatable and needs to be stopped. Are there musculoskeletal biomechanical things? All of us are made differently, and there are a number of things that can happen to the body that just make us hypermobile, for example, being one that can lead to injury and chronic pain issues. And then there is just plain signaling short circuit. We like to call it like where your computer hijacked by a virus. Your central nervous signaling system gets hijacked and stops signaling the way it was intended to. And so these are all specialty things that we're able to take the time, because of the model that we have at Cure for the Kids, we're able to take the time that we need. We're not limited to, typically when you go to your pediatrician, you only get a 10-minute visit, and our healthcare system payment model doesn't support them being able to have a comprehensive team who can take the time to go through all of the necessary information to put all those puzzle pieces together. And so that's a distinct advantage we have with Care for the Kids, with our model being committed to keeping that child and family at the center of all we do and doing whatever we need to do in the extra above and beyond. Because while philanthropy is not our primary source of income, it certainly helps us be able to do a more comprehensive model than traditional medicine practitioners are able to accomplish. So we are, as a team, Dr. Joshi and I, very good listeners and both big believers in not ignoring a parent's gut, being able to help parents sometimes look at things differently or find an answer that they might not otherwise have been considering for the issues going on with their child. It's also really important that it's look, listen, and feel. You've got to just watch when you walk in the room. What's the dynamic? Is that child immediately frightened of you? We try to be very friendly and approachable and non-threatening, and when we go in together, we have a dynamic such between us that often families are immediately at ease, and often by the end of the visit, sometimes even by the middle, we're hearing from people, you guys are so helpful, it's been such a pleasure to talk to you, you've listened so well. That's our goal, is to be hearing that by the end of that visit, that we have allowed that opportunity for them to feel completely heard. We both believe strongly in the Maya Angelou quote of people don't always remember what you said, but they always remember how you made them feel. And it's very important to us that we're listening and making people feel heard, and that they feel we're an important part of their journey, and that we take it seriously, and that it is an honor to be able to be there and help them through this journey. Oftentimes with kids, it's play and being able to play going through the exam, depending on how young they are. And we just adjust and roll whatever the age is. If it's an anxious, overachieving teenager, then we have to talk to them about what their college goals are, for example. And so that we just adjust to however we need to do for keeping your eye on that main goal of making sure that they're heard and cared for. I think I would like to make sure that people understand that there is a wide range of severity of things in the autoimmune realm. Sometimes we have a single joint being affected in a very mild arthritis case versus a child being hospitalized with life-threatening complications of some of our systemic diseases like lupus or mixed connective tissue disease. And none of them are any less important to us, because they're not any less important to a parent. And so our mission and a deep felt belief held by Care for the Kids is that they're all equally important, and that we recognize that for parents, however minor it might be or however major it might be, it's major to you, and we get that, so it's major to us. So that is a core value of Care for the Kids that I think makes us different, and made it very attractive for Dr. Joshi to come here, because it was important for him to practice in an environment like that.